My name is Alexandra Gatti, and I'm a physical therapist at Touro Infirmary in New Orleans, Louisiana, and my specialty is the pelvic floor. So I went through regular physical therapy training. I got my doctorate degree in physical therapy, and then after school I went for extra training on a specific part of the body, which is the pelvic floor. And the pelvic floor helps manage your bladder, your bowel, and your sexual function. So the pelvic floor is a hammock of muscles that run from your pubic bone in the front to your tailbone in the back, and both men and women have pelvic floor muscles. So some signs that these muscles may not be functioning correctly would be if you notice urinary incontinence. So incontinence is when there's leakage of urine, and there's two different types. You can have incontinence when you cough, laugh, or sneeze, or if you exercise, and that's known as stress incontinence. Or you can have incontinence when you're trying to make it to the bathroom and your bladder is full. That's known as urge incontinence. Some other symptoms that your pelvic floor is dysfunctional may include constipation, difficulty going to the bathroom to have a bowel movement, pain during intercourse. Sometimes people have pain in certain positions, and so we can manage that with pelvic floor physical therapy. And also we manage pelvic organ prolapse. So that hammock of muscles that we talked about, their job is to hold in the bladder, the uterus for women, the prostate for men, and the colon. For incontinence, typically the muscles are weak, and so there's a variety of reasons why the muscles might become weak. During and after labor and delivery, that's one time where they may be weakened. After menopause for women, that can happen. Men, if they undergo prostate cancer surgery, can have weakened musculature afterwards. And so in those instances, we would want to try and strengthen the muscles. So the cool thing we do in physical therapy is we use what's called biofeedback. So that way the patient can see on the computer screen what their pelvic floor muscles are actually doing. And so there's a little sensor that can go inside the vagina for women, or we have external little sticky pads that can stick on the outside of the skin for men, and they can see their pelvic floor up on the computer screen. And so we work on trying to strengthen those muscles with that biofeedback. There's certainly times where you can manage this on your own. So if you're just having incontinence when you exercise and the leakage is not so bad, you could probably do a strengthening routine on your own. So the best idea is you want both coordination and endurance of your muscles. So when you look at a Kegel program, that's kind of a buzzword, especially among young women, oftentimes people will say, just try and stop the flow on the toilet. In actuality, what you want to do is either sitting in a chair or standing, try and close and lift the pelvic floor muscles up and in as if you're holding back gas or stopping the flow of urine midstream. And then you want to squeeze and release, squeeze and release. That's coordination. Endurance is your ability to hold the muscles. So you want to squeeze, hold it in, keep breathing, and if you can hold it for 10 seconds and then relax, great. And so the important thing to remember is that you want both the lift and the release. In terms of what you can do with physical therapy, we can actually visualize that for you, like I was mentioning with the biofeedback. So if you're having trouble feeling the muscles, or if you're not sure that you're doing the exercise correctly, you can come and see a specially trained physical therapist who can show you whether or not you're doing it. I think the hard part is that a lot of people are afraid to tell their doctor about these symptoms, and the important thing is to know that it's actually much more common than people realize, and it's never normal. So if you're straining to have a bowel movement, it could actually be your muscles, and you can fix it. And so if you request the help that you need, then you can live a better life. And so I think for patients and just people in general to remember that if they go to their doctor and are honest about their symptoms, oftentimes there is an effective treatment that is not invasive. You know, physical therapy does not involve surgery, and you can come, you get a set of exercises to do at home, and whether it be for strengthening the muscles or learning how to relax the muscles, as often the case may be if you're having pain, we can work together to figure out what your specific needs are.